Assalamu alaikum everyone. I'm Khansa Saeed from Pakistan. By profession, I'm an electrical engineer and currently I'm working as an embedded software developer. Moreover, I have been appointed as the Women in AI Ambassador for Pakistan. So hope all are enjoying the Women in AI Global Summit 2020. Now it's time to add something that how artificial intelligence is helping us in the field of healthcare. So for this, we have Dr. Alina with us. She is an enthusiastic data scientist currently working as a healthcare data scientist in Biome analytics. The most inspiring thing about her is that after the completion of MBBS, she studied programming, machine learning, and data science by herself. So without any further delays, I would like to call upon Dr. Alina to take over this session. Thank you so much.
Thank you so much, Khansa. Thanks. First of all, I would like to thank WAI for organizing such an insightful event at the time when it is needed most. I'm really happy to be a part of it. As Zeshan, general physician, and currently working as a data scientist in Biome healthcare analyst. Today, our talk is around medical sciences and the artificial intelligence application. We will briefly discuss the definition of medical AI, that what exactly AI is in medical sciences. Then we will briefly touch the past of artificial intelligence in medical sciences, the current situation of artificial intelligence, but our main focus will be the future of AI in healthcare data, specifically the potential of AI and what is its current situation and how it can help us more. So if we discuss about the current situation of AI, as we all know that it is already helping us in diagnostic purposes and in treatment, but the AI is still in infancy if we talk about its current situation. In past, actually it happened that in 80s and 90s the potential of AI was oversold, so there was a big hype and everyone was looking towards it. But when the AI was not supportive of it and cannot fulfill all that was expected for it, so there was a lot of disappointment and there was a decrease around in 90s in medical sciences, basically in medical sciences, but overall in all. But then if we say about since the last decade, last 10 years, artificial intelligence is really solving the real world problems and solving the nitty gritty dirty data problems, which is most we are looking forward for artificial intelligence. And the thing is that how it can help doctors, physicians, healthcare workers, from basic nursing staff to the pathologist and everyone who is a part of healthcare. What is medical AI? Actually, it is the combination of complex algorithms and complex machine learning algorithms which are incorporated to emulate the human intelligence so that it can analyze, it can comprehend the real dirty medical data in a much faster way that a human can do. But how it can be useful for us actually? The faster and the personalized, these are two basic words which are most important in the AI, in the healthcare sciences for artificial intelligence. Let me give you an example. For example, there's a patient who feels a bit sick and he visits a doctor. The doctor, after taking basic history and just considering the present situation of a patient, is suspicious that maybe something is not that simple with the patient and something is serious going on. So he orders some test for the patient. What happens, the patient maybe take the date from the laboratory 2 days, 3 days, or after a week. The patient then goes to the laboratory, gives up the test, and if it is a biopsy kind of thing, which is most probably in cancer situations, then it will take no less than a week or 10 days, even 15 days or month, depends. After all this passing of time, the patient then came back to the physician to discuss the results. In this whole scenario, around 2 months have been passed. What physician noticed is that his suspicion was right, and suppose maybe patient is suffering from the life-threatening illness, which can be malignant tumor, simply if we can say not a benign cancer, but a malignant cancer, which is very dangerous and life threatening. And up till that time, which has been elapsed from the first visit of the patient, the first when the patient first noticed its signs and symptoms, until its arrival to the doctor, and then the lab test, and then back to the physician, the whole time which has been elapsed between all these events, what that leads that the condition has been severely damaged, and the patient is now in a more critical situation as compared to which he was around 2 months before when he first noticed his signs and symptoms. In this whole scenario, just think for a moment. Number one, expert physician is involved. Number two, expensive laboratory tests are involved. And the most important thing which I want you to focus is the time, the elapse of time, the wastage of time, and definitely the resource wastefulness is also under consideration. How AI can help in this scenario? Artificial intelligence can step up the game and can help the patient from this early detection of the signs, from the early detection of his symptoms. When he first noticed that there is something wrong with me, at that point, artificial intelligence can easily detect that your baseline, your basic maybe blood pressure and heart rate is just above the borderline, so you should be conscious right now. Moreover, rather than the test and all that, biopsy and this laboratory time wastage, the artificial intelligence can do this thing quickly, like within a day, less than a day, and give you the more accurate, more precise results. And not just the test results, it can give you the conclusion as well, that what the patient will take the results to the physician to ask for it conclusion. The artificial intelligence can do that quickly and can tell the patient accurately that, look, here is your test results, and you are suffering from these illness, and what this the most probable diagnosis is this, and you have to start your treatment now. He can if it can, maybe in future it can tell us exactly about the treatment, which I will discuss, which is very interesting topic of artificial intelligence in healthcare. My really interest is in the personalized treatment. We will discuss about it. So artificial intelligence can help the patient to start that treatment for that specific illness to that specific patient early when the signs and symptoms were noticed. So all the time which has been wasted of the patient from its travel to home, to physician, to lab, and back to the physician, and then start of the treatment, and the time has been wasted, all these things can be saved by artificial intelligence. And luckily, one part of artificial intelligence is doing very great already, that in the diagnosis of the cancer, many numerous cancer actually, breast cancer, TB, lungs cancer, it has already doing great job with a high specificity and accuracy. Let me tell you, in 2018, end of 2018, AI correctly diagnosed the pulmonary tuberculosis with a sensitivity of 95% and a specificity of 100%, which is a really great deal, and it sometimes outplay the physicians in diagnosis. So what we are looking forward, and what we are as a healthcare worker, as a physician, we are interested in artificial intelligence, incorporation of AI and ML in healthcare, is the wastefulness of resources can be stopped with this. A hospital is involved, the whole laboratory, the test, the healthcare workers, these all things, these all resources then can be directed towards a more specific things which artificial intelligence cannot cover till now and then its use can be more productive and more helpful. Just like I told you, the more focus point is a personalized treatment, and personalized not only if we can start from the drug treatment. every patient is different, and there is no hard and fast rule for the patients, for the physicians to prescribe any treatment. As you have noticed, let me give you another example, very interesting. You instantly, maybe you already have noticed that somehow you for example, your family member, your neighbor, or you are suffering from some minor illness, and you take some OTCs, the tablets, the medicines which are available freely on the counters, and you take them and you are cured with it. But if the same illness, the same signs and symptoms are experienced by your maybe friend, by maybe neighbor, or any close anyone who you know, and you said that, hey, this is a medicine, I took it and it was very helpful, I got better, you should take it too. And then the same signs and symptoms were not cured, and you maybe think that maybe medicine is expired, maybe he didn't take properly, maybe he is not cautious while taking it, or other thing. But the point is, medicine is right, time and the situation is right, signs and symptoms are same, but the drug which is useful for your body, for yourself, may not be as useful for the other person, because there are biomarkers. But you can think about biomarkers as a particles in the human blood which dictate about the prognosis of the disease, the reaction of the patient to some specific drug, the presence of the disease, and the treatment, that how whether it is useful for a patient or not. Here comes the main focus of the point, the personalized treatment. Every patient is different, these biomarkers are different. There are, if I explain it in a more simpler words, every person experience internal factors and external factors for any disease, physical, pathological, presence of anything. As you have already noticed, allergy, in the same situation, few people are more allergic to the thing, and there are many people who are very comfortable in the same situation. You knew, many of you knew, these are dictated by the genes. Genes are in our DNA, these are part of our cells, these are inheritable. And uh, let me tell you, artificial intelligence has already decoded the genes and already explained that how a gene translates the prognosis, presence, or threat of any disease in any patient. So it is very useful if we learn beforehand that this patient is more vulnerable to develop these kind of diseases. So, for example, rather we already knew what happens, that there is a diabetic patient, and it is heard or said that because his mother and father, or maternal uncles and paternal uncles, are already suffering from the diabetes, so more probable that the patient, the son or daughter of that family, will be suffered from the diabetes. This is one example. There are many other diseases which travel with the genes, which travel from the parents to the kids, and there are many disease which makes a person more vulnerable to any disease. If we translate those diseases earlier, then we can help the patient that you are more prone to develop these kind of diseases, so you should take these precautions earlier, so that your quality of life can be improved. A disease is made to be maybe it will be you are suffered from that disease in later part of life, but what we can do, we can improve the quality of patient by already telling it, by gene decoding. We can already tell the patient that this disease is probably you are more vulnerable to this disease, so take these precautions so that your life can be prolonged, the quality of life can be increased. Next, use cases of artificial intelligence in diagnosis, in treatments, and what one more thing. Uh, as you see that when a patient is ill, then he visits a doctor, then he visits a hospital, and then the baselines are checked. But there are many cases when we need more granularity of the data. We need more portions of the data so that a trend line can be made. And what AI can do, there are many devices which can be worn by the patients, which can immediately tell the patient that your blood pressure is at morning this, at evening this, at night this, at afternoon this. You should take care at these specific part of the time, so that you may not develop the disease, which if you will continue these all circumstances, this specific disease is underway. So to avoid that, keep a close check on the particular site of the thing. So the wearable things, number one, they can collect the data in a more granular fashion, and thus they can keep a track of the patient. And then when a patient visits a doctor, the doctor and physician can easily see the whole line, the whole trend line, and can easily comprehend then what's exactly going wrong with the patient. In the future, what AI can do, rather the patient visits to the doctor, it can help the patient there and then. Like maybe it can beep that your blood pressure is going out of control, your heart rate is going out of control, your blood sugar level is not under control, so you should take care of these measures. And the visits of the patient to the physician can be saved, the time can be saved. So it is how AI is helpful for the society, for the hospital, for the whole global helpful it in the medical sciences, that these all resources can be saved when if AI can be used more practically. We totally accept that AI is still in basics in medical field, just because there is very much personalization which vary from person to person. What we used to do, we used to calculate the risk factors, but there is no hard and fast of it. Whatever we try to predict, every patient comes out 1 in 100, 1 in 50 comes out with a different outcome. So this is the personalized word which I really want to focus, where we cannot just dig all the data and put it in the AI machine learning algorithms, let it learn it, and then we're expecting then boom, it gives all the correct results. It can never gives that result because of the variation from person to person. For example, if you consider there are brother and sister like from the same family, or even more, like there are twins having the same twins and having the same genes, but they are experiencing different external environmental factors which we know as external factors. Maybe one is more exposed to sun, one is more exposed to oxygen, less carbon dioxide. All these are external factors, and which makes the response of a patient to any drug, to any treatment variable, even they are sharing the same set of genes. What happens that because of these external factors, because of these environmental factors, the few genes mutate at some point of the life, and then artificial intelligence can decode these genes and can help in the detection, in the prognosis, in the treatment of that specific person. Already it is underway. There's a lot of work is still going on with personalized drug treatment, but with the help of the biomarkers which I described earlier, the molecules, in simpler words, they are the molecules in the body, in the blood. Those biomarkers are taken from the patient, and then they are taken to decode the which drug is more helpful for that specific kind of patient in that specific scenario, and the response is then checked. And before giving it to patient, rather than any hit and try, we check it beforehand, that how a patient with all these external and internal factors and the gene combination and the presence of these biomarkers, how it will respond to some specific drug. And this specificity of every patient is the essence where artificial intelligence can really practice, and we can really step in and can really help the healthcare. It happens that because of mutation of genes, there is some, you must have experienced that in some time of life, for example, you're having a fever, a cold, and maybe some flu type of symptoms. You take an antibiotic with the prescription of physician, and you are good and you get well early. Wow, happy scenario. But after maybe year or two, the same medicine is not effective for you, and you are surprised that what's going on. The medicine is not right, I'm not taking it properly, or what happens. Actually, this is the genes, the specific set of genes which are mutated in the later part of your life, which what happens that the same drug which is helpful for you in earlier times is not anymore helpful for you, and then you have to switch the combination of the drugs, or altogether the whole treatment should be switched. Artificial intelligence can help very much in this personalized treatment, in the personalized diagnosis. So it means maybe you people are curious that it will replace the physicians. Okay, interestingly, physicians can never be replaced. Artificial intelligence can help a lot in the healthcare landscape. They can join hands to make the services better. But when it comes about patient management, about the compassion, about the empathy, which a person needs, a social person, a social entity needs, then the machines are not reliable. Then it is always in the hands of the physician, and a patient trusts the doctor more than any machine, any robots. And this is the portion which no machine can ever replace. So physicians should be open-minded, I must say, to accept the invasion of the artificial intelligence and machine learning, and they can take help from them, so that the healthcare, the basic patient response can be made better, can be early diagnosed, the resource can be saved, and the time of the physician can be saved. So now a physician is exhausted to make two types of decisions. Number one, that it has to diagnose it early, then it has to give the treatment, and meanwhile it has to convey all this information to the patient in a way which it can comprehend and it can relate, whether it is a breaking of a good news or it is a breaking of a bad news. A physician or a healthcare worker delivers it to a patient in a manner that no machine, no artificial intelligence has been able to deliver in that manner. So physicians are not replaced ever, they are there, but artificial intelligence can help in those fields, in those part of this all scenario, which are not, which can now, which can be done by machines faster, in a more better way, and in a more, with a more accuracy actually, because a doctor has the experience of the all the studies of the exhaustive 5 to 6 years of studies, then all the practical experience which he has faced in the hospitals, the days and nights. These things can be done by the machines without the wastage of time and with a more accuracy. So there's a combination of both machines and healthcare workers, which are when combined together, then they can result in more better and in more fruitful manner, not at a personal level, but at a society and for the whole global level. Artificial intelligence till now is doing great in diagnosis, as discussed earlier. Another thing what it can do, actually there are two main types of artificial intelligence in healthcare. Number one, virtual, and number two, physical. Virtual, like electronical health record, and the blood pressure monitoring, sugar level, and images, biopsy, and lungs cancer, all that. These are virtual. But it is also assisting in surgery, as we all know. Robots are there and very intelligent machines are there, which are performing the surgery on the live patient. Still, it is underway. because during a surgery what happens, physician has to take the decision according to the situation, according to the scenario, and maybe quick decisions has to be made there and then. There is exactly where artificial intelligence can help to this is the portion where artificial intelligence can help in virtually but not so much in physically. Remote surgeries are still on the way and they are doing, and few results are very much better, but this is no better than a surgeon can do. But and we are looking forward for future that artificial intelligence can be helpful for for those life threatening illnesses like infectious disease or cancer. It can help in early diagnosis, early treatment, and most importantly the personalized treatment, which can help in the resource, which can help in the time saving. And thus we are looking forward that AI is poised to make um, huge advancement in every field and in medical science as well. Thank you. If you have any questions, I'm here. Thanks.
So thank you so much, Dr. Alina. It was a wonderful talk. And maybe it feels good when you say that physicians can't be replaced and physicians have to be open-minded to work with the advancement in artificial intelligence. So thank you so much for this, so much useful insights in this field. And also before our session ends, I would like to thank all our participants of Y Summit who attended this session and they were interacting with us through the chat. It feels great. So anything you want to say, Dr. Alina, to our participants?
Actually, it is the fact, Khansa, that physicians are really reluctant to accept the machines. And my interest was very much into the computer, so I was always related to it. But when I see the pure physician and pure healthcare society, they are very far away to adapt the changes. So
Definitely.
my message is that we should accept the change. World is changing. So rather than traditional sites and traditional work way, we should adapt to the new way so that world is fast and we have to compete the time actually.
Absolutely, absolutely. So, okay. So now it's time to end our session. And I hope you all enjoy our rest of the sessions, which are going to be. So thank you so much. Allah Hafiz.
Thank you. Bye all.